Welcome to AFMC TV. I'm Robin Ledbetter.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults to were very creative.
Down on the floor and play with their kids.
AFMC TV, thanks for watching and have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Pearl McElfish, and she's the founding director of the Institute for Community Health Innovation at UAMS. Dr. McElfish, thanks so much for being here.
Thank you. I'm excited to be here and talk about rural health.
So tell us what the Institute for Community Health Innovation does and how it is centered on improving health across rural and undeserved communities.
The Institute for Community Health Innovation is really all about meeting people where they are. And UAMS has such amazing specialty care and innovation. And we want to make sure that those advances in health get to the most rural places in Arkansas. I was born and was raised in Arkansas, some of the most rural places in Arkansas. So I'm really passionate about ensuring that no matter where you live in Arkansas, you have access to the services that UAMS offers.
So what does that mission look like in practice today? Are you seeing a change?
So it really looks like partnerships across the state and mobile health across the state. So some of the examples are we're working with school districts in Arkansas and some of the rural districts to help them understand how to prepare and provide healthier food options for students, because we know if you can get good nutrition in school, you can build a better state of health. For example, many school children get 75% of their calories in school. And so it's such a great opportunity to really shift outcomes. Other ways that we're partnering are with rural health clinics to examine opportunities for remote monitoring or continuous glucose monitoring as part of remote monitoring. And then, of course, the rural workforce. We know that we need physicians across the state, and the residency programs that Arkansas or UAMS offers in Arkansas. We also need community health workers, and we need doulas and those boots on the ground providers that can really ensure every rural community in Arkansas has access to health.
And the idea of meeting people where they are often comes up in your work. Why is that so critical for improving outcomes in Arkansas?
You know, we often say people are hard to reach, but people are where they are. They're living their lives. They're going to work. They're going to school. And we really just wanted to turn that narrative upside down and say, it is imperative that we go where people already are. And so we are working with churches, with schools, with work sites, places that people already are. I think part of my passion comes from the fact that I grew up 16 miles down a dirt road. We were literally in the middle of nowhere in Searcy and Van Buren County. And understanding that my family worked hard, we contributed to society, but the likelihood that we were going to drive to Little Rock and receive services was highly unlikely. But if we could access services at work, at school, at church, we could really access the care that would allow us to thrive. And so that's really the foundation of my passion.
And it's so much of it is about collaboration across sectors. How do partnerships make rural healthcare stronger?
We have so many great rural hospitals, critical access hospitals, federally qualified health centers, and family medicine providers who are committed to their communities. And it is critical that we partner with those so that we can reinforce, build them up so that they can provide services. And so when we think, for example, of the grant money that we may bring into the state, about half of that goes out to our partners so that they can provide care. And so it's just such a critical foundation to not replace what's happening in rural communities, but to really build up and increase their capacity so that people can have access to the care they need.
So what does a healthy partnership for, say, schools, churches, community organizations look like?
It definitely has to be that win-win, which we would expect or may sound cliche. But I think the most important thing is not just UAMS and the partner winning, but that both of us are committed to the community member winning, and that we come to the partnership with this commitment that we really want our friends and family to be taken care of. And I think the nice thing about Arkansas being such a small state, when we develop a new program, like I'm thinking of my aunts, my uncles, my spouse's family, and thinking, what would they need to have to thrive in Hector? What would they need to be able to thrive in Clinton? And that really, that patient in the center, that person in the center really is imperative for the healthy partnership. And again, making sure that the partner wins alongside whatever UAMS is bringing.
So why is it no longer enough for healthcare systems to work in isolation, especially in rural communities?
Well, one, we don't have enough resources, and we're not going to have enough resources in the foreseeable future. We cannot afford to duplicate services. And I think beyond that, we have poor health outcomes. And I think as discouraging as the poor health outcomes are, I'm encouraged by we're only one phone call away from a solution, because we don't have 7 degrees of separation in Arkansas. We probably have 1 degree of separation from a cousin or a family member. And we definitely, with 2 calls, we can get in touch with someone who can help us work together. So we can't afford to go it alone financially, and we can't afford to go it alone based upon the disparities that we have. We have to work together to put our community first so that we can see that shift in health outcomes.
And let's switch gears talking about workforce shortages. One of the biggest challenges that you're seeing facing rural healthcare. How is your institute helping to train and support the next generation for those rural communities?
So one of the things I'm most excited about, we're going to launch the first year this June, is training community health workers in high school. So they will get college credit, they will be trained and certified so that they could go out into the workforce. We now know that community health workers are going to be reimbursed, so they could get a job that is a livable wage out of high school in their rural community. But we're also doing the college credit because we hope many of them go on to be nurses and doctors and pharmacists, and to have them stay in their rural communities to practice. So for our institute, we are focused on community health workers. We're focused on doulas. We're about to launch a program for perinatal mental health certification. But for UAMS, when I put my broader UAMS hat on, I'm most excited about our 3-year rural physician track, nurse midwives. I think that is going to be a game changer for Arkansas. And then the family medicine obstetrical fellowship. And so we have one in El Dorado right now. It's graduated. Dr. Ciasia James graduated and is now practicing in El Dorado. So it's doing exactly what we hoped it would do. And that is bringing doctors to the rural areas to do their fellowship, and then them staying there to practice. UAMS hopes to start those family medicine obstetrical fellowships in other rural parts of the state. And so I think it's not just one thing. It's really looking across the continuum of a provider's license, having everyone practice at the top of their license. I'm also encouraged about what pharmacists can do. We talk about physicians. We love physicians. And nurse practitioners and PAs and pharmacists can be such an important part of the solution, particularly within rural communities. Communities that don't even have a physician often have a pharmacy and a pharmacist. And so how can we leverage everyone's skills to care for people, again, right where they are, and yes, coming to Little Rock for care when they need it, but the day-to-day, can they get that in their rural community?
So how can healthcare leaders rethink workforce models to better serve communities with limited provider access? You touched on this a little bit.
Yeah.
What's the next phase?
I really think it is practicing at the top of your license. I think the technology that we have today, whether it is wearable technology, telemedicine, advances that will happen in AI-assisted technologies, allow us to have people who are supported, because what we want is a rural provider who has the support that they need, often from UAMS. Quite frankly, we are so great at providing the peer-to-peer, provider-to-provider support and programs like the high-risk OB or the stroke program. That type of thing can and should be scaled across Arkansas, where rural providers can be supported in their rural community, but that we're not doing that at the sacrifice of having the highly trained specialty care and the support between the two.
What skills or competencies will be most important for rural healthcare workforce for the future?
It's a great question. I think one of them is the combination of high tech and high touch. I think we need those person level skills. Technology is going to continue to advance, like that is a given, but we also need the healthcare providers of the future to be able to connect with individuals at a level that can help motivate them to take the steps that they need to do. And so while we might say that they need to have advanced technological skills, I think that's a given. And I think investing in these more person-centered skills is going to be equally important.
So your work often happens outside of traditional clinical settings in homes, schools, community spaces. How does that change the way care is delivered?
Flexibility, I think the willingness to drive down the dirt road at times, but also just the flexibility to meet people where they are. And I know I use that term a lot, but sometimes that does mean setting up care, setting up navigation for social determinants of health in a church. And being flexible to understand that for some of the things we provide, again, particularly for health education, social determinants of health, that can be done just as well in a church basement, quite frankly, a McDonald's or a park. And so that willingness to break down those boundaries is critical.
So how are innovations like mobile health units, telehealth, or even community-driven programs expanding across Arkansas? Are you seeing that happen?
Yes, I think that, so one of the projects that we are just finishing up was a remote monitoring system for postpartum women and called Telemom. We were able to enroll almost 2,000 women in this study. We're excited to see the result. We're in the time frame where we're getting to analyze the results. But what we were able to show is that we enrolled a lot of rural moms. And so even though cellular access can be sometimes a challenge, that you can do that remote monitoring in a place like El Dorado or in Helena just as well as you could do it in Little Rock. And so I think I'm excited about that. I think as we think about mobile health, my prediction is that we will think about it differently. So sometimes mobile health is going to be a wearable. Sometimes mobile health are going to be those big vans that we typically think about. Sometimes mobile health is a advanced practice nurse in a minivan with an ultrasound driving to that church because that's where the woman feels most comfortable and they have a room and we can kind of set up those mobile clinics there. And I would also posit that sometimes mobile health will mean helping a person get transportation to that specialty care that they need, that MRI, that CT scan where they need. And so again, this not saying that mobile health is one thing, but really understand that mobile health and meeting people where they are can take a lot of different forms. And certainly within UAMS as a whole and the Institute for Community Health Innovation, we're embracing that broad definition of mobile health.
So are you seeing measurable improvements in health outcomes from these partnerships-driven approaches?
We're definitely seeing measurable outcomes in our individual pilot projects, programs, or studies. Where I think we are excited, particularly in maternal health, is to look at a population level. What we really want to see is not just these 2,000 women that we did remote monitoring improve. We want to see that the 30,000 women who give birth each year in Arkansas are able to have better outcomes. The policy, we made so many policy advances in this last session, and so we're just beginning to analyze that data now, and I'm very excited and very encouraged.
So if you could give one piece of advice to healthcare leaders watching today, what would it be when it comes to strengthening rural healthcare through partnerships?
Meet people where they are and be willing to grapple with the fact that in partnerships there will be misunderstandings. Everyone's not always going to agree, but that ultimately if you're willing to have that conversation and stick with the discussion, Arkansas is going to win. And kind of keeping, for me, it is, I have an aunt who I love dearly. Every time I do a program, like she's at the forefront of my mind because I think, what would it take for her to do remote monitoring? What would it take for her to access mobile health? And so I think keeping Arkansans at the forefront and being okay with a little bit of discomfort in that collaborative process, because ultimately Arkansas will win.
Well, thank you. Thank you for being here today.
Thank you.
Sharing a lot about the programs, a multitude of programs, not just one focus, a multifaceted focus to programs across the state. Thank you for being here.
Thank you for the opportunity to talk about something that I love so much.
Well, I'm excited to have you back on next year to see how far we've moved the needle.
Some outcomes data. I'll commit to that. Thank you.
Thank you. And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.